I hope your previous 4 sessions have been terrific.
Yeah, it's phenomenal.
Great. We'll try to meet that standard or more. So we're talking about family partnership. And you cannot talk about that without first talking about family. And I love this definition of family. We no longer, when we used to say family, it was, 2 parents and 3 kids. No longer. So I just feel compelled to read this to you because it's so rich. It was written by a family member, Polly Rango, who is also co-founder of Family Voices. Call it a clan, call it a network, call it a tribe, call it a family. Whatever you call it, whoever you are, you need one. Families are big, small, extended, nuclear, and multi-generational, with 1 parent, 2 parents, and grandparents. We live under one roof or many. A family can be as temporary as a few weeks, as permanent as forever. We become part of a family by birth, adoption, marriage, or from a desire for mutual support. A family is a culture unto itself with different values and unique ways of realizing its dreams. Together, our families become the source of our rich cultural heritage and spiritual diversity. Our families create neighborhoods, communities, states, nations, and I'm adding schools because that's what we're about today. Don't you just love that definition? Yeah. So as we talk about how our families are really self-defined these days, there is no one definition. Each family defines itself. We also have to consider that no one family can raise a child. It takes a village. The beautiful African saying, it takes a village to raise a child. And schools are an integral piece of the village. No better example than the past year, when schools on a dime had to pivot into educating our children virtually. But even more than that, schools often became the food distribution centers, the places that distributed laptops and helped families access Wi-Fi or check in on students and families. They really were unsung heroes. And any of you educators or advocates or parent peer support providers in the past year, unsung heroes for sure. It's been a challenging year, and schools have really, really risen to the occasion for that. So just a high five to all of the educators and parent peer support providers and nonprofit organizations. It took a village to get us through the past year. So often the terms parent involvement and family engagement are used interchangeably. The Child Welfare Information Gateway has distinguished these 2 terms. And I think it helps to kind of separate them a little bit. So when we talk about parent involvement, it's almost our parents participating the way we want them to. So if you look at this, the language is more in the context of a service provider rather than a school, but I think it's very much applicable to a school. So in other words, is the parent bringing their child for treatment, or is the parent helping their child get their homework done? Is the parent signing the homework? Is the parent, coming to the teacher conference, that kind of thing? It revolves around outputs. The number of times a parent does something or the number of times a student does something, but it really implies getting the family to do what you want them to do. So the school needs the paper signed, the school needs the parent to come and, sign in at the office. It's all of the things that are required by the school. Engagement goes further. Engagement is really embedded in the work of the whole school, or maybe it's a whole mental health center, or provider, whomever it might be. It's really a top-down, bottom-up. It's a commitment of leadership as well as of staff. As a family member, when you walk in a school or a provider organization that has family engagement, you know it. You feel it. You feel welcome. You know it often with a provider when you call on the phone. If you get a robot answering, saying push 1, push 2, as opposed to a human being that is actually interested in what you need, what you want. Likewise, when you walk into a school, may not be your child's teacher in the hallway, maybe another teacher. They're there to welcome you. So you know it, you feel it. I'll give you an example of a not family engagement. And I don't often use negative examples, but this one it was recent, it was last week, just stood out in my mind. And it's representative of what's been happening the last year in the worst of ways. I was with a grandmother at an IEP meeting. The first IEP meeting she had requested, I encouraged her to request the meeting. And at the meeting for her granddaughter, whom she is the guardian, she mentioned that her husband had died, who was the other guardian of the child, and the children's mother, her only child, had committed suicide, all in the past year. The guidance counselor knew that information, and no one else knew. The principal didn't know. The children's teachers didn't know. The school psychologist didn't know. And I had to ask myself, how could a guidance counselor know? And the rest of the school does not know the trauma that this child has been through. That's an example of what I would call not family engagement. There was no relationship building there whatsoever. It just broke my heart. So what we really want, however, engagement is good, engagement is great, but we want to ramp it up. We are aiming for partnership, family partnership. And family partnership is a whole paradigm shift. It shifts and redefines the relationships in healthcare and education by placing the emphasis on collaboration, on sharing decision-making, sharing power, sharing information. So the difference between involvement, engagement, and partnership is light years different. Achievable, however, doable. So again, we're talking about all of this in the context of the family as they define themselves. Look at the context for the IEP I was at last week. That was a grandmother raising those children on her own. So husband and wife, Ann and Rod Turnbull, from the University of Kansas, have studied partnership with families many, many years in the context of special education, in the context of education, in the context of mental health. And they arrived after surveys and all kinds of research at principles of family engagement, family partnership. You see them here. And what you don't see, however, is that these are actually they're mobile. and there are strings attaching these. So the principles are communication, respect, equality, competence, advocacy, commitment, and trust. Is there any one of those that to you would be more important or possibly more challenging than the other?
I think for me, advocacy is a really, really tough one because it's really needed, but it's not acknowledged here in New Zealand. So it's very hard to get seen as an advocate, but it's really needed. Yeah.
Mm-hmm. Okay. Thanks, Adriana. Michelle, any thoughts?
I'm sorry, I was muted. So harmony with Adriana, even here in the States, in the United States. I was providing advocacy, but I also worked for the school district. And to be able to find that balance of neutrality where I could say, I'm helping you, because like my goal was to make sure that the family's voice and choice was heard. But then it's like the school district is like, we paid you, so you better not do us wrong either. So, trying to find
it's a tough role. Yeah.
Trying to be neutral, but to represent both on the same respect was very taxing for me.
Okay, you mentioned advocacy and respect. Okay, Khalil, any thoughts?
Not really. I don't think I have like any like thoughts of like how the individual like or how any like or how any of the plans have been like like kind of like working with people.
I'm so sorry, you're breaking up. I'm sorry. We couldn't hear you. Well, let me tell you what the Turnbulls found, which this is this is their research. So put it in that context. It may not resonate with your experience, but they found that the foundation was trust, that you couldn't have the others without trust. And I think, Michelle, this, I think it speaks to the kind of dilemma that you have working with families. So when you have families that don't trust, the challenge is then, and they may not trust for very valid reasons. They may not trust that English is not their first language, or they have had negative experiences, or they may be homeless, or they may not have food. They may be embarrassed about that, or they may have a child with behavioral issues that, they get calls every other week or maybe twice a week. Your kid just threw a chair across the room, and they feel distrustful that the school is trying to get their child out. So when you have that lack of trust, what then do you do? That's really the challenge we face in building that partnership. Any thoughts how you establish trust when there is none?
Well, I know my position is the family peer. So the thought is, like to say, I'm a peer, I'm with you. I'm like, I walked in your shoes. You can trust me, but then they're still looking like, well, you still getting paid by them. So I really can't trust you. So it's really, a challenge and taxing, because there's still that the fact that they're saying you still are dealing with them. So it's either us or them.
Yeah.
Yeah. So I'm exactly the same.
I'm getting a signal. I'm getting a signal that I need to move on, but I don't want to go without sharing one more piece with you.
Okay.
You're going to get this. It's called the Dual Capacity Building Framework for Family School Partnerships. I like it because it talks about the challenges, not just for educators, but also families. It talks about what processes and organizational Conditions need to be in place to build that partnership. It talks about programs and policy. I like that it includes policy, and talks about outcomes. It was developed, I think, in 2014, partnership with the Harvard School of Education and the US Department of Education. This is version 2 that I think came out in 2019. It has a lot of information. They call it a framework because a local school district or school needs to put the meat on it. And you, in whatever your role, cannot afford to wait for a principal or a superintendent to get this rolling. You, in whatever capacity you are in, can start this ball rolling as a change agent.